Dr. Omananye Daniel Energy. My current job is a medical officer in a teaching hospital, that is the state teaching hospital. Before this time, I had several certificates, like I've been a nurse. I schooled in Ahmadu Bello University, Zaria, where I obtained my degree, that's Bachelor in Nursing Sciences.
Currently, as a doctor, do you feel that there is need for the Nigerian government to look into the healthcare system?
We don't have doctors. You cannot count at any hospital that will tell you they have enough doctors today in this nation. Nigeria is producing doctors, but we are not seeing them to work in the sector. So Nigeria is always producing, a doctor that is going to work with another nation. And the little ones we are having, they are not cared for. They are not being taken. Their welfare is so poor that they are running. You see doctors running from one state to another, one hospital to another, trying to see, to balance up about the welfare. And some of them that have opportunity to run out of the country, they are going, the Japa syndrome. They are going out of the country.
So is that not something for a nation like Nigeria to be highly scared of?
Yes, it's something to be scared of, but there is one thing our politicians do. When they are sick, they already know they will go to America, go to London to go and obtain care. So they don't really bother about the poor masses that needed to see doctors. So it is a problem. So you can see a patient who came maybe like 7 a.m. to come and open up a card trying to see a doctor. And because there are less doctor on ground, that patient can sit down from like 8 o'clock till 3 p.m. still waiting for his or her name to be called, to be seen. So they are there, and the government is not trying to do anything. So you tell me, the little workforce that Nigerian system is having, they are not paying them well. So will you be talking of employing more hand to work with, to work in the hospital? So they are not caring for them. And then even the ones that are coming up, they are not even ready to work with Nigeria health sector because of the poor package, the kind of the way the government is handling the health workers in this country.
So my question is this: if this system is that bad, let me use that word.
Yes.
Is it fair enough to say that it's not a reasonable thing to be doing this work and with the amount of money that doctors are being paid? What I'm trying to say is that, is the work worth it?
I think it is out of passion, and if you are called, like this popular question they normally ask us when we are coming out of secondary school: what do you want to be? Then you say you want to become a doctor. Why do you want to become a doctor? You said to help my society better. And I think one of the things that is a driving force is seeing your community, the members of your community suffering, and nobody to help them. The government is not taking care of them. So if you are not going to sacrifice your time, your life to help these people, then who will help them? So out of that passion and out of the curiosity to help our people, the society, the patient in our society, to make it a better society, we are doing what we are doing today. It's not out of what they are paying us. What we are doing is not commensurable at all with what we are being paid with the package. So it's just out of passion. And what will you do? You can't see your neighbor suffering, and you said because you don't have money or they don't pay you enough, you're not going to attend to them. So you have to. So money is not in the forefront, but notwithstanding. So wherever a person is working, that is where he eats. So the government needs to attend to the welfare situation of the doctors too.
Okay. So with this 48 hours, 78 hours call duty and so on and so forth, does it affect your decision making towards patient most of the time?
Yes. You can imagine every time I'm on clinic days or call, I wake up and I start thinking of the workforce and then the stress of the work I'm going to face. And by the time you have spent several times, like I can't recall sitting down in the call room, let's say from 9 o'clock till 4, 5 o'clock. I can't recall who will even give you time to go and have your break without break. No breakfast, and the government system is not even bothered. Nobody care about, what you eat. So, things like that is just happening in our society. So now it will definitely affect the way you work. Because when you are tired, I will not tell you lie. There are times when you are tired and you still have a lot of patients to cover. You look at patients that their cases are not critical, are not emergency. You just, place them on some tablet and give them another day to come, so that they will not say, doctor did not see them. Just give them like a week to come back so that you have time to attend to them. And sometimes, because you are in a hurry, you can imagine the time, the working hour is gone, and you still have numerous patients outside to attend to. You are in a hurry. You don't have time to waste with the patient. You don't have time to take a detailed history of that patient to attend to them. So it definitely, it has effect on, our services to patients.
You have worked as a nurse.
Yes.
You have worked as a doctor.
Yes.
Now we have seen the cases of our politicians leaving this country to get a better health care in other countries, the US, London, France, and the rest of them. I want to know, based on your experience, is it that our medical facilities have shortage of equipment for treatment?
Yes, it's still the same approach, that they are not taking care of the health personnel. So the health personnel you are not taking care of, will you buy equipment for that person to work?
Wow.
So you will not. They don't bother. So the equipment that is available in the hospital are just few. In fact, I will give you an example. Not quite long ago, a patient was rushed to the hospital and I was called to attend to the patient. It was a case of a premature delivery. So do you know that in the gynae ward where I attended to that patient, I had to take the delivery of that patient in that ward, and then struggling looking for ordinary blade to separate the placenta from the baby, and a prematured baby that needed to be incubated. So it was like, hey, patient relatives, quickly run to the pharmacy to go and buy surgical blade. What I mean is that, at least, look at forceps like scissors, cord scissors, and all those artery forceps to clamp the umbilical cord before you cut. They are not just readily available for me to use. There are no enough equipment to take care of this patient, and sometimes you can imagine where you want to take patients' vital signs, then you have to go to triage, maybe accident and emergency, to bring their own BP apparatus to come and take patients' vital signs, and immediately you are there trying to take patients, and another person is waiting to collect the same apparatus because it is also needed there. So you will discover that in most of the hospitals that even have some of these apparatus, they are just having maybe one or two that they can manage with. There are no resources, no enough resources. These things are supposed to be available. We are not supposed to be looking for it. And sometimes we have to write some of these apparatus for patients to buy. Patient will buy their thermometer, So patients will buy, some of them have their BP apparatus. I could remember one certain time that I needed to take blood sugar level of a patient, random blood sugar level. So the machine, the only one we have, was not working well. Immediately you insert the test strip, it will tip off. Do you know that patient has to bring their own, their personal own, to the hospital? These are not supposed to be. So these are equipment, little equipment that are supposed to be in the hospital. Not to talk of the mega equipment. How many of our hospitals have a CT scan, MRI machine for patient? So when you admit a patient that need all those things, because there is no MRI, not because there are no health personnel that can take care of such kind of condition, you have to refer them to another hospital that have such kind of thing. Listen to other doctors from other part of the country, they will tell you the same situation, the same thing. So I think our politicians, they need to start developing our hospitals, our facilities. You go to some, especially the healthcare, the primary healthcare facilities, when you go there sometimes, you wonder, what are they doing there? Because there's nothing that shows it's a hospital. You just see maybe scanty chairs, as if maybe the patient that are coming are just coming to see the health personnel and go back. If they need admission, there is no facility to admit them. So you just see them and let them go. And some of them, you discharge them or you tell them to go to another hospital because they don't have enough, resources, no financial, capability. They will go home and be looking for money. By the time those patients come back to the hospital, the case is already in a critical situation, complications that is difficult to tackle. Then maybe the patient relatives will begin to fight and begin to shout that they are not taken care of, or nothing is done, and all those kind of things. So this is the situation in our country that needed to be addressed by the politicians.
Let me just divert a bit. Do you feel the rate of death in the hospital, these things are the factors to it?
Yes, they are part of it. For example, I just cited one example. So the hospital where I took a premature delivery, they don't have an incubator where the baby can be incubated. You can imagine if you have to transfer, if you have, because the way that patient, came, there's no how we can stabilize the patient and refer the patient. I have to just take the delivery that day, because you can't abort the contraction of the uterus that is, leading to the coming out of the baby. So when I took the delivery, I have to leave the mother down and start taking care of the mother. I start taking care of the third stage of management, or the third stage of labor for the mother, while I send the fetus, that is the baby that was just delivered, like a 28 weeks old baby, that was to another facility far away from that hospital for incubation. Now tell me, between the time I refer the patient, I send the patient, and the time the patient reach there, a baby that is struggling, the ABDA score is so low. What do you expect of such kind of baby? So you can imagine such a situation. The rate of survival of such kind of babies is slim. It's part of the issues that leads to the death of patients sometimes. It's not actually that maybe the healthcare personnel is practicing negligence. But if the material is not there for you to work, there is nothing you can do. You are handicapped. It's like sending a soldier to go and combat Boko Haram without gun. So what do you expect of that soldier? The Boko Haram will slaughter the soldier. That is what is happening in the health sector in our country. Even sometimes the MRI work, today, tomorrow, there is fault. So, and at that time when you need it, where do you refer the patient to? And sometimes we have to refer the patient outside the whole state to another state. And a critical case, a critical patient, you refer them like that. Even on the road, they can die, they can park. So these are issues that we are having in our country. The situation they find themselves in is not favorable. So it's not negligent. I'm not saying that you cannot have a case of negligence, because several times on air you heard people talking about, patient, trying to sue a hospital to court because they didn't take care of their patient well and all those things. I'm not ruling out completely that there are no doctors that practice negligence, but most of the cases, it is because there are no equipment, and then there are no favorable environment for this doctor to work. And that is what is also affecting the outcome of the healthcare services that we are rendering to patients.
So do you feel any doctor in Nigeria can afford to build a house on their own within the period, or own cars of their own within the period of 5 years?
With the welfare package that doctors are receiving now, it's not possible. If a doctor will build his house or maybe buy a car, maybe a doctor that have no family, so a bachelor who devoted themselves, work here, work there, and combine them together. So at the end, he might end up gathering everything he has within that 5 years just to buy a car. And the car we are talking about, what kind of car are we going to buy? So we are talking of at least something that will move him to working place and all, not the current or a car of his choice. So it's not possible. It's not possible, except if that person is a doctor in the politics that have access to, all these political monies that will be able to do that kind of thing. So it's not easy.
Of recent, we have been seeing high rate of burnout time with doctors. Have you ever had a situation where you had to do 48 hours, 72 hours at a stretch, call on duty, either as a nurse or as a doctor?
Yes, as a nurse, I was running shift, so it doesn't happen like that. But when I became a medical doctor, that was when I knew that doctors are not actually having time. They are not enjoying. And one of the things is this, especially this call duty normally happen during maybe public holidays. That's non-working days. So I discovered that doctors doesn't have public holidays. So if the public holiday fall on your call day, nobody cares about it. You have sacrificed that public holiday for call duty that day. And I have an opportunity. I have a situation when I work like 48 hours just on call, no rest, no sleep at night, and it was a pathetic situation. And because the healthcare sector, we don't have enough hand, so you are receiving call from, you can imagine a doctor covering up to 3 wards. You are receiving call here, maybe 1 call here, 2 call from another, another department, another ward, and then maybe in accident and emergency, they are calling you there. So you are now like trying to prioritize these calls, which one need urgent attention before you attend to them. So before you go around, take care of the patient, you are tired, moving up and down, and then that burnout is there. The stress of work is there.
So what is the cause for this burnout?
It is still because we don't have enough doctors. For example, in the Western world, where I had that, 4 doctors can be attending to a patient. So you can imagine in our own country, where a doctor is attending to up to 30 patients in a day. like my last clinic, I was there from 8 o'clock till 4 p.m. After like 6 o'clock, we are still seeing patients. Then the patient some of them will suddenly stood up and start making trouble. Doctor have not attended to us, and very soon now they will tell us they want to go home. I know there is no time and all those things. So we have to calm down and calm them down, so that there will be order in the treatment, so that we attend to them. And sometimes when I was a house officer, I once be in the clinic from morning till 7 p.m. just trying to attend to all the patients that came to the hospital.
Do you feel we have enough nurses in Nigeria?
There's not enough nurses in Nigeria. In fact, with my experience, I've moved I've worked in many hospitals, not less than 3. And in all these hospitals, at least I've worked with Federal Hospital, I work with Teaching Hospital. Presently, I'm in Teaching Hospital. Sometimes you see a nurse attending to up to 15 patients at the same time. So just a nurse covering a shift is not funny. So we don't have enough nurses. I remember when I finished reading medicine, one of the things that I was told by the management of the federal institution where I was working was that we don't have enough nurses, and you are leaving the nursing profession again to a medical profession. So I have to tell him that likewise, medical profession, we don't have enough doctors. So I'm leaving one to another one, but to function better, because our focus is still one. So in Teaching Hospital, the same thing. Then it's even worse in general hospitals and maybe primary health care. I have an opportunity of lecturing, as a part-time lecturer, and of recent we gave a project to one of our students, that is nurses, ratio to patients. And at the end, when the research was carried out, we discovered that it was not funny. There are a lot of gap between, that is the number of nurses to patients. So, and when such kind of things happen, it brings about burnout in work areas, and the nurses is just trying to meet up with the man, try to write up report, try to hand over his or her shift. It's not actually funny. The nurses are seriously lacking.
So what exactly do you think is causing the shortage of nurses in the healthcare system in Nigeria?
There are many things that...
Do you think it's the Japa syndrome?
Yeah, it's one of them. It's one of them, because I will not tell you as a nurse, I won't tell you lie. I have my colleagues like from School of Department of Nursing, those people that we graduated together. I can tell you, I can count many, almost half of them that are outside the country now. So those people, you can imagine if they are in Nigeria and they are well, taken care of, and they contribute to the health sector, the service they render to the health system of Nigeria, it will be far, far better.
So do you feel that in years to come now it's going to be worse?
Yes. In fact, if you are looking at the way the government is dealing with the health sectors of this Nigeria, I wonder what is going to happen. Because this is an era everybody is just thinking of going to where they can make it, where they are recognized, and where they have a good atmosphere to work. But the situation in Nigeria is not favorable. Several times we think of strike. Even currently, there is a strike action going on. Nurses, ALOD, they are on strikes. So now, you can imagine this kind of strike action. By the time they resume and their complaints are not met, maybe the government cannot meet up with their demands. So what are you expecting? When they have a better chance of going outside the country or relocating to another state, they will go. So except there is a change in the care system, that is how the government is caring for the health sector and then the human resource in the health sector, it is going to be worse, because people keep traveling and they keep processing their paper to travel, writing exams to just leave this country to where they feel they are better.
You say they are all living for a favorable environment and probably favorable pay.
Yes.
That simply means nurses are not being paid well currently.
Nurses are not the health sectors. The remuneration is just too small. They are not paid well currently. In other like European countries, the truth is that nurses are highly paid. To the extent that I heard, of some doctors that even went and read nursing outside, and some of them, when they are outside, they even work as a nurse. When they came to Nigeria, they work as a doctor. So the truth is that the way the Western world pay their nurses, I keep wondering what is wrong with the administrative setup of this country, that they are not recognizing the nurses in Nigeria so that they can give the best, in the health sector. So when you compare the pay outside, that is in the European country, and to Nigeria, honestly, it is a pathetic situation.
As a doctor and as a nurse, have you ever thought about leaving the country?
Yes. It is actually the issue of Japa syndrome is actually a syndrome. Any health personnel in this country we always think about. The only thing is maybe the environment surrounding. If it is not favorable for you to leave the country, then maybe you just try to manage the situation. There's nobody. Personally, I had several people talking to me. With your level of understanding and what you are doing, what are you still doing in this country? Are you not planning to leave? Even now that I'm talking to you, if I had my way out, and there are countries that need my service and they'll take care of me, take care of me, why not? I will go, because I don't see the country taking care of the health personnel in this country the way they are supposed to do. They are not even ready. They are not showing us any limelight that they are ready to take care of their health personnel. So it's also always a question, not only with me, many of the health personnel that I have come in contact with, if they have opportunity, they will go to.
Then what do you think should be put in place to make sure that we have enough nurses in our healthcare system?
The government of Nigeria, they have to start thinking of recognizing the healthcare sector, especially the nurses. They need to value them. I used to think sometimes that our senators, the lawmakers of this country, the government, did they actually, at least when they are sick, most of them, they go to overseas to receive treatment. Did they actually ask those people how they are being taken care of? So their welfare there, did they actually care to know what is happening? And do you know the funniest thing? Most of them, they will leave this country to a European country for treatment, and it is still the Africa, that is the nurses from Nigeria, that is treating them there. Then, if you have nurses that can take care of you outside, why can't you take care of their welfare in this country, and they will still take care of you in this country? One thing is this: they must consider their welfare package. It is too low. It's not enough. Considering the economic situation of this country, they must put into consideration the welfare system, the welfare of the nurses, and then secondly, the government needs to equip hospitals, the various health facilities that we have, so that when those health facilities are available, they can lay hand on it and do their best. What they have learned in the school, they can practicalize it and then use those material, to take care of the patients that are coming to the hospital. Government must create enabling environment for the nurses to also work. So you cannot, before you see a nurse that will perform, to their best of, their ability, at least you should be aware. You should care for them, where they are sleeping. Do they have houses on their own? You see nurses trying to patch up, staying, with a colleagues, trying to rent accommodation. The salary they are even paying the nurses is not even enough to pay accommodation at a stretch. That is a befitting accommodation. Then tell me, how do you want such kind of nurse, to perform to their best ability? They are not mobile. So we are talking of, how many of them can buy a good car to take them to office? And then look at, the situation of this country now. You can imagine a nurse that is being paid, let's say, 150,000 naira in a month. Then if he's a car owner and he has to fuel that car with 100,000 naira in a month to move her to working place, then what is remaining for her or him to take care of the family? There is nothing. So you will see some of those nurses will park their car at home. There is few of them that have access to a car. You park it at home, then take Okada to working place, and then sometimes they patch with their colleagues, to join them with their vehicle to office, then back home. All those kind of things they are not encouraging at all. So if Nigeria take care of their nurses can do better.
This is what you wish your doctor told you.